Are all the panelists in now? I mean, all the attendees inside the room?
Looks like it.
Okay, now let's get started. Welcome to the February 2021 Global Health Tuesday webinar. What's next for COVID-19? Lessons learned for 2021 and preventing a future pandemic. The Global Health Tuesday seminar series hosts researchers and practitioners from the University of Wisconsin-Madison and across the world. The speakers showcase the complexity of global health challenges and the many kinds of expertise needed to address them. By sharing their experiences with the campus and Madison communities, these guests provide insights into global health, encourage conversation, and help connect colleagues locally and globally. The series is hosted by the University of Wisconsin-Madison Global Health Institute, and you can find more information about this and other events and news on the website ghi.wis.edu. The next Global Health Tuesday seminar will be on March 30th, Holistic Healing Within Community, Global Mental Health Perspectives During COVID-19. GHI Associate Director Lori Dupree Brown will moderate an international panel to look at promoting psychological well-being, and especially in the midst of a pandemic. GHI's annual Global Health Symposium is April 14th. The theme is Fostering Resilience Through Indigenous Wisdom and Scientific Knowledge. And the event brings together a diversity of panelists from the university, the Madison community, and Wisconsin's tribal nations. Before we get started with today's Global Health Tuesday seminar, a bit of housekeeping. You are muted upon entry, and if you would like to ask questions or participate by providing comments on this topic tonight, please put them in the chat and we will receive them there. And if you are tweeting, please use the hashtag Global Health Tuesday. Tonight, we will look at lessons learned during the COVID-19 pandemic from 3 different vantage points. We will hear from Jonathan Patz, Director of the Global Health Institute and an international expert on climate and health. Also, Kristen Bernard, a virologist and professor of pathobiological sciences in the School of Veterinary Medicine. And me, Ajay Sethi, I'm an associate professor in the Department of Population Health Sciences and faculty director of the Master of Public Health program. We will each use our respective lenses and a framework that surely is familiar to you. We will speak about a total of 15 minutes and then move into discussion. So please type your comments and questions in the chat before then. We've learned many lessons in 2020. I will get us started with 4 sort of key host-related factors which I believe define the SARS-CoV-2 pandemic. SARS-CoV-2 has a unique transmission dynamic and characteristics that have really made it hard for us to control as the host of this virus. The virus can spread by individuals who are asymptomatic. Now, this was not documented for the previous SARS virus, nor was there ever definitive evidence that this occurs in SARS-CoV infection. Seasonal influenza can also be transmitted before the onset of symptoms, but only 1 day prior versus 2 days for SARS-CoV-2. The infectious period of SARS-CoV-2 does not substantially overlap with the onset of severe illness, hospitalization, and a need for ICU care, further illustrating how most of the transmission of this virus occurs in the community as compared to healthcare settings. And this is quite different from MERS, which was known for nosocomial superspreading that was well documented. And in fact, a recent CDC modeling study estimated that transmission from asymptomatic individuals was estimated to account for more than half of all transmission, and that the identification and isolation of persons with symptomatic COVID-19 alone will not control the ongoing spread of SARS-CoV-2. So this brings me to my sort of second lesson learned. Mitigation strategies work in combination, and we know them well, but they must be supported and followed. I'm sure you've all seen versions of the Swiss cheese model for preventing spread of respiratory pathogens like SARS-CoV-2. No single intervention is perfect, but a combination of individual and shared responsibilities has significant positive impact on the pandemic. There have been well-documented disparities in who acquires infection, requires hospitalization, and dies. Here I will show you data on mortality only. After adjusting for differences in age, Pacific Islanders, Latinx, Indigenous Americans, and Blacks have been twice as likely or more to have died from COVID-19 than whites. And this figure and others that examine the disproportionate impact of COVID-19 that has been on underrepresented minorities come from the American Public Media Research Lab. Now, yesterday, as a nation, we acknowledged the surpassing of 500,000 confirmed deaths due to COVID-19 in the United States. And the latest data from an Axios Ipsos poll shows that 1 in 3 Americans of all races know someone who died of COVID-19. It's important that stories of people who have died prematurely not be forgotten. On Twitter, I follow Faces of COVID, which was founded by Alex Goldstein in March of last year, to remind me that there are individuals behind the statistics that we all track and report. This brings me to the last host-related factor that I will give, and that is host immunity. No one had immunity to SARS-CoV-2 at the outset. And 1 year later, the majority of people in the US still do not have protective immunity against infection with SARS-CoV-2. So we remain vulnerable to sort of a fourth surge of infection in this country. And given the number of people who have died in the last year, we must remember that continued mitigation and vaccination are the better paths to controlling the pandemic and not immunity from natural infection. And with that, I yield to Kristen Bernard.
Thanks, I needed to get unmuted. And of course now is the time when my dog starts to bark. So hopefully everybody can still hear me. And thanks for that lessons learned, Ajay, that was great. What I'd like to do now is talk a little bit about the pathogen. And the next slide, Ajay. And I just kind of want to go over this timeline because it really illustrates how much we've learned over this past year. And the first infections have been traced to December 2019 in Wuhan, China. And it was first noticed atypical pneumonia, was connected with some live animal markets. And then, though they were concerned, and WHO was notified on January 3rd of last year. But just within a few more days, the Chinese scientists identified a novel coronavirus. And so that was very rapid that they determined what was the cause of this atypical pneumonia. And at that time, we didn't think that it was, we were seeing any person-to-person spread, but at the end of the month, it was suspected, the end of January, and then confirmed after that. In February, the entire sequence of that genome was reported and available for all scientists in database online. And As you know from following the pandemic, in March, WHO declared it as a pandemic, not just an outbreak. And what I find completely remarkable was that phase 1 clinical trials were started in March 16th using the mRNA vaccine. And that just is phenomenal that happened so fast. And then, of course, as you heard in the news and now know that if you've been potentially been vaccinated or know people that have been vaccinated, the FDA gave emergency authorization for the vaccines, now 2 vaccines in the US. December 18th was the first one with the Moderna. Next slide, please, Ajay. And this I just find still remarkable that we had in just 9 months an FDA authorized vaccine that has 95% efficacy. So that was tremendous. And I think that it really points to the importance of being prepared by knowing something about this virus, knowing something about the family of viruses, but also having a good different types of vaccines that we can call on, different platforms that we can call on to develop very rapidly new vaccines. Next slide, please. And here, this just illustrates, I borrowed this from the New York Times. They're great at tracking the vaccines and how many are in phase 1 clinical trials. We've got 37, now 6 that are authorized. You can see how many have gone through these different phases and 4 that are approved for full use throughout the world. So just really tremendous rapid response of all scientists throughout the world. Next slide, please. The other thing we've learned, and this isn't really very much of a surprise since this is an RNA virus that we know mutates, but we have been tracking as the global scientific the evolution of this virus. And you can see from this is from next strain, the different variants in the different countries. And I'm using the pie chart to show how many different, the preponderance of those various variants. And the darker orange color and the red color are those variants of concern, the South African, UK, and Brazilian variants. And you see that we don't have too many in North America yet, but that is growing, and we have had reports of some of those variants in Wisconsin. But this just outlines how important it is to be doing the sequencing so that we understand what changes are happening, and if those are of concern. Do they cause more disease, more transmission, et cetera? And of course, the South African and UK and Brazilian variant are suspected of having more transmission. So that's why they are of concern. And the next slide, please, Ajay. And I finally want to end with how we think this emerged in the first place. That's sort of my interest is zoonotic transmissions. So in the next slide. And Ajay had mentioned about that first Sars coronavirus that happened in 2003, the MERS, the Middle Eastern Respiratory Syndrome. And that first SARS, all 3 of these viruses actually, Sars Coronavirus 2, the current pandemic virus, they all likely originated in bats. But we don't really understand what that next jump to the next animal species or animal reservoir, how that happened, and if there were some other animals in between. But for the first SARS coronavirus, we believe that it went into some live animal market animals, such as palm civet cats and raccoon dogs, before getting into people. And as Ajay mentioned, there was less human-to-human transmission of that virus, but we did see some. And as far as MERS coronavirus, again, we don't understand that connection between the bats, but we do know that camels are the major reservoir that then transmit it to people. And fortunately, there's even less human-to-human transmission of that, and primarily in healthcare settings, as Ajay had mentioned. And then finally, the SARS coronavirus 2. We really don't know. The ancestor is a bat, but we don't know what animal reservoir was important for the jump to humans. And in the last slide, please, Ajay, second to last slide. There was a recent WHO investigation that perhaps you read about, and they were trying to investigate what that animal was that was responsible for the zoonotic jump. They do believe that it was probably not that original animal market, and instead that original animal market appears just to be a super spreading event for humans. So we still really do not know what it is, and more research is definitely needed there. And in my last summary slide, what do we learn about the pathogen? Really, the research has been fast moving. We already had some basic knowledge about the virus, which really helped us, as well as those vaccine platforms. If we didn't have that, we'd be in a lot worse shape at this point in time. But for the future, we really need to continue good surveillance efforts to identify those mutants. We need to study the origins of this virus to understand that zoonotic transmission. And I'll stop there. Thanks, Ajay.
Jonathan, are you unmuted?
Okay, there. Now someone allowed me. Thank you. Yes, great presentations, and I'm going to just start where Kristen left off about talking about looking for the origins, going upstream, and we don't pretend that we know them, but we have learned from previous diseases why environmental factors are quite important. So I'm going to be talking about lessons we've learned from other diseases as far as environmental underpinnings. Next slide. And I love this op-ed. I saw this image, what the coronavirus pandemic tells us about our relationship with the natural world. You know, we've known for a long time that as we disrupt ecosystems and change biodiversity, we see disturbance and disease emergence in various places. This is not news. Next, Ajay. We published this paper on unhealthy landscapes 17 years ago and documenting all sorts of environmental pathways through which diseases emerge, and particularly zoonotic diseases. As Kristen mentioned, zoonoses. A majority of emerging diseases come from animals. So, you know, animals in the natural world, if you're disrupting the natural world, you're going to be disrupting the habitat or the behavior or the density of these animals, and that can present various risks. Next, Ajay. And because we are all cheeseheads, I'm going to show another Swiss cheese diagram following Ajay's example. This one comes by way of Professor Raina Plowright, who's an expert in spillover, zoonotic spillover. And what you see in these tiles, if you go from the top, let's just go with the left column that's moving. Every time you see that blue lightning strike, everything lines up. And what happens is you have a rare spillover event. And it's in all likelihood, that is why we have the COVID-19 pandemic coming from a zoonotic disease, likely from bats, possibly intermediate reservoirs, and recombination, changing the ability of that virus to enter humans. But all these things have to happen to get a spillover. And starting from the top, imagine the animal reservoir host. If there's disturbance of the environment, you may change their migration pathway. You may change, going down, the reservoir host density. So imagine reduced habitat and overcrowding of bat populations, possibly. And then when the animal reservoir is packed together with high density, then the infection passing back and forth between each individual increases, so the pathogen prevalence goes up. infection intensity goes up. Certainly more infection around, then it can be released into the environment. And if it survives and humans come into contact in that environment, then you can see a spillover event into humans, assuming that person is not wearing protective clothing, a mask, has been vaccinated. So that's the within host barriers. Next, Ajay. Especially looking to the front of this, land use change, climate change, could these large environmental disruptions be the first push for, setting the first domino to go? Next, Ajay. And actually go back for just 1 second. I'll say that, this comes from her work, Dr. Plowright's work on bat-borne Hendra virus. And in fact, there was in Australia emergence of this bat-borne virus that was deadly to horses and to humans. And it was documented that the migration pathway of the bats that carry Hendra virus was altered because of vast deforestation across Indonesia and Borneo. There were no food supplies, and these bats were forced to migrate. So we have examples, especially from that one, bat-borne Hendra virus. Next slide, Ajay. This paper was published 2 weeks ago. It's a hypothesis generating paper showing changes in climate that may have led to a change in the species diversity in bat populations in this region of interest. It's a question mark. We don't know that this is the answer, and I certainly wouldn't want to speculate, but these types of big changes across the ecosystems and forced by climate, seeing disruptions in where bats congregate, it just begs the question, could this be one contributing factor? Next. Now, there's another environmental relationship with COVID. This was a study done from Harvard epidemiologists this earlier, actually last spring. And they compared the top map, which is an average over about 17 years of air pollution in the United States, comparing to the bottom map, which is deaths from COVID-19, and controlling for all of the factors that you need to control for as an epidemiologist, human density, and you name it, all sorts of factors. If you hit the next button there, Ajay, these scientists found that an increase of just 1 microgram per cubic meter of air in fine particle pollution, so PM 2.5, just 1 microgram increase, which is a tiny increase, increased the risk of dying from COVID by 8%, which is, to me, it's a stark relationship. That's pretty serious. And so again, environmental factor here with COVID, and also this is an equity factor as well. And if you hit one more, Ajay, this is where at the front end, the potential for ecosystem disruption and zoonotic disease spillover, and now this relationship with pollution and risk of dying, we have environmental factors both at the front and the back end of COVID-19. Next slide. Another lesson we've learned from shuttering the global economy is that when you turn off fossil fuel combustion, you stop driving and you stop air traffic, and you've pretty much shut down the global economy. You see less air pollution. And one more, Ajay, just to highlight. Oh, I'm sorry, go back. I thought I had yellow highlight here. So in China, from the shutting industry and reduced air pollution, across these a two-month period, they estimate 24 100,000 lives saved in China just from that reduction in air pollution, and about 2,000 lives saved in Europe because of shutting down fossil fuel combustion. And you know, it's not rocket science. You clean up the air, you save lives. Next slide. So I'll just wrap up by this news from Sunday. First cases of bird flu in Russia. And, you know, these things are always out there when we think about how we are growing our food, what we're doing as far as our natural resources. And one more button, Ajay, and I'll just end by saying that, you know, pandemic prevention must include far more focus on upstream environmental factors across both natural and managed systems. So with that, I thank you and welcome questions and discussions for all of us.
Thanks, Jonathan, and thanks, Kristen, for your parts. There's some questions that already came in the chat. Maybe I can go through some of them quickly, and then we can just see where they go. So the most recent one actually kind of is something you can maybe address, Jonathan. How will cities and communities have to adapt in order to become more resilient to potential future pandemics? And that's coming from Emily Engel.
Yeah, so that's a great question. It's a tough question, but I think it's something where we have to have multi-pronged approaches. You know, we always want to go as far upstream as possible as far as prevention. And in my own bias is that the more we keep ecosystems intact and benefit from the natural sort of nature services, the regulating services of intact biodiversity, intact ecosystems that seem to better regulate and keep diseases from emerging. That's front end. But as far as cities, obviously early warning and surveillance to be prepared, and then city-wise, being able to adapt to extremes in climate and be prepared for migration of people when we have forced migration around the world. Big question. That's just the beginning, maybe 1/10 of what you need to know, but I'll start and stop there.
A good example when scientists, you know, I don't know, it's like the best answer, right?
They need to do
very challenging, very challenging.
Very challenging.
Linda Bauman's asking a question that Kristen, maybe you can answer here. What is it about bats that makes them carriers of the virus?
Yeah, that's sort of the $1,000,000 question. But first I want to make sure that Linda understands that bats are not the carriers for the current Sars coronavirus 2 or the MERS or the initial SARS. We don't know what that intermediate animal is. Now, it could be a different bat, right? But at least not the bat viruses that we've been able to isolate from bats. They're not the same. And in fact, people that are experts in this estimate that it's probably the bat virus diverged about 40 to 70 years ago before, it's at least 40 to 70 years an ancestor compared to the Sars coronavirus 2 that we have now. So there is some long distance there, even though it's our closest relative of the viruses that we know. But what makes it about bats are often problematic as far as being those hosts where the viruses are jumping. We don't really know. They do have a very interesting physiology, so we all sort of speculate that maybe it's something to do with the fact that they often hibernate. Not all bats do, but some are hibernating. It might be something about their immune system that allows the virus to be perfectly fine and not cause disease in bats, but then be a reservoir for other animals and humans. So we really don't know the answer, but it is a fascinating question.
Okay, let me also let me ask you, Kristen, also, and Jonathan, both of you were talking about spillover. And I've seen some literature out there where some people say maybe it's not spillover, even though that is sort of maybe the dominant hypothesis, that there's this competing circulation hypothesis that maybe it's just a random event that led for this virus to sort of enter human populations, and maybe it's been around longer than we thought. Have you heard that, Kristen or Jonathan? And so what are your thoughts about that?
Yeah, it might be better for Jonathan to take that one. It's a little bit more. Do you have any ideas, Jonathan? And then I'll add on.
Yeah, so I mean, there's always the question of undetected viral chatter, is this something that's happening in the population, and we don't see it until some mutation or some random event, as you're saying, brings it up to a higher level, and you get your first epidemic. Instead of a few people being infected every couple of months, all of a sudden you see a spike, and that leads to accelerating and into an epidemic. I mean, there's always that issue of viral chatter, but I haven't heard in this case, because it's so similar to SARS-1, and this sort of zoonotic spillover has been documented several times, that it just seems like, coronaviruses, it seems like this is what happens with several coronaviruses. So whether or not there's viral chatter going on and that it just emerged, I think we have enough historic cases to think, it's probably like these other spillovers from of coronavirus. But I defer to Kristen.
Yeah, I guess I would just add, for the case of SARS coronavirus 2, it is still an ongoing question, but WHO investigation didn't see any evidence of that virus prior to December. So, if there was chatter in the 6 months ahead, at least they don't think there was. Although maybe there was some more community spread, because that's hard to know in the community that didn't reach the healthcare situation. Could there have potentially been some chatter? But I guess also maybe, Ajay, are you thinking a difference of spillover versus just that random event, and just the bad luck, or when your video showing the bar going through the cheese holes, Jonathan? That's almost a random event. And I guess spillover in a lot of ways is you think, oh, there was just so much transmission in the animals that it spilled over to humans. Is that sort of what some of the nuance you were trying to get at?
Yeah, I mean, I'll send you the paper, and what from, it's not getting a lot of traction since it was published a few months ago, but it's just positing that it may not be a single species, that the virus may be circulating, and eventually the right combination of mutations allows for, transmission to humans and between humans.
Yeah, I mean, I kind of believe in those kinds of stochastic events. So I think that is a possibility, and it would be interesting to read more about it. And hopefully,
and I think the authors were also trying to, basically, I think the title might have been "It's Time to Exonerate the Pangolin." That the idea that it's, instead of putting blame on one species as being the cause of this event, that the blame really rests on us for doing exactly what Jonathan was describing about climate change, land use,
absolutely,
and what our responsibility is.
But I do
absolutely agree with that. And the pangolin also is a very distant virus relative. So the pangolin isn't the direct.
Yeah, that was.
There are enough studies out there that show sort of the genetic evolution that points to, zoonotic origin. So I think that's where, when there was the first question, was this bioterrorism, or was this a human-made virus?
Accident, or
that there were studies, I think, in either Science or Nature that just nailed it to say, no way, everything about the genetic makeup looks like it was an evolutionary process that, no signatures of what you would normally see with a intentional human-made thing. So at least we know, at least most of the studies are just pointing that this did not come from human manipulation. That's not your question, I know, Ajay, but that was an earlier question all along about conspiracy theories, and that's been pretty much disproven and looks like it comes from a zoonotic origin.
Yeah, so I'll just insert into the discussion Tom Eul's chat message, which bats are receiving increasing attention as reservoirs of various viruses. Given the remarkable taxonomic diversity around the world, monitoring all of them over time is not practical. How best to monitor and focus our attention?
Yeah, I mean, that's a great question, Tom. Thanks for that. And you're absolutely right. I mean, their taxonomy is very diverse. And, I think we're just going out and kind of sampling certain bat species and finding viruses. I think it is really difficult. Maybe ones that have more contact with people might be one, or with livestock, because we do know that, of course, the Nipah virus went into swine before it got into people. So maybe that would be one way to attack that. Jonathan, do you have any other ideas?
No, I'm happy with your answer.
Hard question, Tom. That was a hard ball.
I also want to comment that that we don't necessarily feel the capability of answering every question, and if others on who's attending, and I see some names who can definitely provide perspectives, please add it to the chat, and I'll read that aloud.
Absolutely.
To more discussion. And I'm looking at you, Jim Conway, because I'm going to migrate to some of these vaccine questions. So, Kristen, you mentioned from the New York Times sort of tracker, 4 vaccines that have been approved. What are they right now? We know the 2.
Right, the 2 in the U.S. that have been the emergency approval, and that's the Moderna and Pfizer, of course. And then the other 2 that are been approved in other parts of the world are the AstraZeneca and the Johnson & Johnson. Now, the Johnson & Johnson, I understand, is close to being approved here as well. And maybe Jim or somebody knows a little bit more about that, or Ajay, maybe you know more about that.
The FDA is meeting Friday, I believe.
Okay,
yeah.
And that one is a 1 dose, so that's an advantage. It's an adenovirus vector instead of the mRNA based like the Moderna and the Pfizer. It also doesn't need to be as cold. It doesn't need to be at -80, so that's an advantage. I think that one's at 4 degrees. So that's a refrigerator temperature.
Yeah, and then a question from Donald Kretschmer. Are vaccine makers working on booster shots to deal with the variants as long as the virus is widely circulating, mutating, especially here in the US? Will we need a booster every year for the foreseeable future?
Yeah, and unless somebody else is on the chat knows better than me, we don't know the longevity of the immune response yet, nor do we know how much it really is going to change, and such that we would need a booster because of the change in the virus, like we do for flu every year. We don't know the answers to that yet. As far as, I guess stay tuned on that answer. As far as whether or not vaccine manufacturers are starting to look at those new variants, and yes, at least from what I understand, they are. And a big advantage of really the adenovirus, any of the ones that are approved now throughout the world, very easy to modify those vaccines because we have the sequence, we can modify them. You just have to scale back up. And I understand the FDA has a pretty short approval for those kinds of changes. So that's good news.
That sounds reminiscent of influenza, where we have the platform and the process kind of approved, and it's just a matter of updating.
Right. Now, the problem with the influenza, of course, is that we have to guess from what's going on in the South, and I'm sure you know more about this, Ajay, than I do. and what's going on in the Southern Hemisphere to what then we're going to be problems for us in our winter. And it has to be grown up in eggs, which takes quite a bit of time. So if we guess wrong, sometimes we don't have as much efficacy as we would hope for. Guess, I should say it's an educated guess.
So
Jonathan,
Ajay, I see a question from Ambassador John Lang. And I was wondering if I can just.
Please, yeah.
Maybe some pandemics can be prevented, but aren't some inevitable given the many possible sources? So, you know, it's a very tough question, and it's a reminder that, you know, when we try to eradicate diseases, you know, we did eradicate smallpox, but when we try to eradicate disease, it's very difficult, especially complicated diseases that are zoonotic diseases or vector-borne diseases. And it gets to evolution and ecology, that in many cases, you know, diseases are a natural process. And so the key is to try to reduce as many risks as we can. And to the extent that we may be doing dangerous, following dangerous activities, for example, factory farming of food is, you know, is just fraught with trouble and, you know, antibiotic resistance and you name it. It's just a bad idea. How we are disrupting natural systems, overfishing our oceans, you know, reducing biodiversity and disrupting nature. These are just bad ideas that are bound to set things out of balance. And, you know, we are bound to have more problems, more emerging diseases, just stirring up trouble. So yes, it's true that, you know, diseases are natural. And when we have high populations in our species, you know, it's just something that you have to deal with. But can you minimize the risk? If we're doing something that is blatantly a bad idea, we want to make sure we minimize those activities when we learn about them. And so the more we're learning about them every day, and there's a lot that we need to know about relationships between ecology and disease emergence. But the more we look, the more we find connections. And so that's where I just want to say prevention, prevention, prevention.
So I'm going to scroll up to Barry Hardup's question about the new variant reported from California today via ProMed. I had not seen it yet. Have either of you seen that? Yeah, Kristen.
Yeah, I think he's talking about a recombinant, I think, right? I saw that in the chat. Yeah. So at this point, I want to say that coronaviruses are just notorious for recombining. The way they replicate inside the cell, recombination happens very readily. That's quite normal. And the fact that they found it, you know, have we been looking for recombinants? And so it is a recombinant between, I think, the UK strain and the currently circulating LA strain. So for that to happen, the cell has to be infected with both those viruses at the same time. So they both have to be circulating in the environment, in the community. And then recombination can happen. It's very easy. At this point in time, I don't think we have any reason to think that that's going to be more pathogenic or more transmissible, except for, of course, those mutations that are from the UK strain. So I don't think the recombinant necessarily is going to be more pathogenic or more transmissible, but we will need to monitor for it.
It underscores that as long as we let that virus replicate in communities, we will get variants and strains in the future that
absolutely
may escape our strategies.
And so I think the vaccination, and as you really pointed out, Ajay, to continue the mitigation strategies and the vaccination to prevent it, because new variants are going to come up, and they're coming up.
Now, speaking of new variants, I see Chris Olson asks, he says we can't prevent novel virus emergence, but rapid identification of new threats can be greatly enhanced by developing more integrated surveillance systems, integrated in particular between animal and human databases and integration across geopolitical borders. Absolutely critical. I would add, I've participated in debates where there's not a right answer of, should we invest more in improving surveillance or in upstream modeling and predicting emergence? And usually, you know, as far as, because it's so hard to predict emergence, obviously we do need, you know, better surveillance. But I would argue, obviously we need both, you know, and if we can, you know, if we can find the upstream determinants and figure them out and prevent them, for sure we need great surveillance to catch these emergence when they happen, because they're so hard to predict. But I wouldn't give up on prediction. And as always, it's not either or.
I think you're right about that. It's both, right? Thanks for that, Chris. That's really important.
I'll react to an exchange about antibiotic use on the chat from Cindy and Tom. There is no connection between antibiotic use and sort of how a virus may respond in the presence of antibiotics, since antibiotics are, you know, targeting bacteria. But Cindy brings up a good point that antibiotic use does promote antibiotic resistance, which is obviously an issue we've been dealing with for a long time. And I feel like there's maybe more interest in tackling that, given our general awareness of infectious disease threats overall. And so maybe there'll be some renewed sort of will at all levels to sort of try to prevent antibiotic resistant microbes. Let's see, so what other, I have to repeat what Jim Conway says. As Yogi Berra said, it's tough to make predictions, especially about the future. Let's sort of, there's one sort of above question. Let me scroll back. Gregory Sheehy says, in retrospect, what one or two things should have been done differently when this viral situation developed in China? And let me just sort of add to that, piggyback my own thoughts to that question. A lot of hotspots, you know, exist all over the world. The next big one, the next pandemic, you know, is going to involve cooperation and going to require cooperation between governments, between scientists, and sort of what can we do to sort of promote more of that in general? I know it's easier to ask the question than to answer it. Are you seeing, Jonathan, are you seeing sort of more momentum as a result of COVID-19?
Well, yes. I mean, COVID-19 is it's something that well, of course, number one, it reminds us of the importance of science. So that's number one. But it also shows the importance of having good communication across sectors, sharing information. This sort of reminds me of West Nile virus when it came into the US, and, you know, between the veterinarians and the epidemiologists, there wasn't great communication. COVID-19, you know, calls for that much more cross-sectoral communication, because, you know, food systems, transportation, deforestation, and habitat. I mean, these things are so interdependent. And I think if I was to take away one key message, it is that, you know, these things, and especially diseases, are absolutely interdependent on everything. You know, it goes back to, you know, John Muir's famous quote, you know, when you pull on any one thing, you find it hitched to everything in the universe. And I think this pandemic teaches us that if we, you know, do the reductionist siloed approach and try to just say, we need X and we need Y, and we ignore all of the interdependencies, including, you know, the health inequities and the access to care and the, the other part of what COVID has revealed of the inequities of our health system, especially in our country. These lessons of, not dealing with things in separate silos is absolutely critical.
Yeah, and I just would say, Ajay, I think that from the virologist point of view, the virology community really came together. And I mean, I think I saw it also, working here at UW, there was a lot of the physicians, epidemiologists like you, the virologists, ecologists, that everybody was working together to make decisions. And I think though the basic research in virology that's happening, I really saw a lot of collaborations, and I think that's super positive to come out of this. But as Jonathan said, we need to work together.
Yeah, I mean, a pandemic affects everybody if we go to the Latin roots, right, of the word pandemic. And there are a lot of people who recognize this threat as I mean, obviously it's had a lot of impacts on our society. The other day, I was looking at sort of all the departments at the University of Wisconsin-Madison. There's a list you can find, on our website. And I couldn't really think of a single department that isn't trying to tackle some issue related to COVID-19 right now. Everything from the arts and humanities to various sciences, communication, business, the economics, everything is affected. And it, as to speak to what Jonathan said, it does take a lot of collaboration to not just prevent the next pandemic, but all the sequelae from the next pandemic.
And early on, there was the engineering Make It lab, when the PPE was short, they made shields with their 3D printers, and it was pretty amazing.
That's right. That's right. So when the three of us sort of planned this sort of seminar, we intentionally were going to go short, 15 minutes, so we can have time for this conversation and sort of hear what audience members had to say and what they wanted to ask. Since we only gave ourselves 5 minutes, is there anything that you didn't say that you really wanted to say, or ask that you didn't want to ask? I'm curious.
I'll let Kristen go first.
Oh, okay. Because I wanted to talk about the mink.
Yeah.
So I think this kind of goes to what Chris Olson was talking about in the chat. How important it is that we share information between both the veterinary and the medical field. And there have been outbreaks in mink farms where this is basically a reverse zoonosis from people to mink. I think it's very important because there's been the transmission in some of those mink farms just exploded. I mean, just unbelievable mortality in those mink, and transmission rates just unbelievable. So we were getting a lot of variance in those mink as well. And so I think that's critical to understand that. In the Netherlands, they did identify some transmissions from mink back to people. So fortunately, those did not go community spread. So they were just the workers on the mink farms, and there wasn't community spread outside of that. Maybe they would have been the same type of variance as what we've been seeing, but it's always a risk. So I think that's a critical thing that we need to be watching for.
So, in my ID Epi class, my bulleted list on one slide of sort of what are some factors that contribute to the possibility that we can eradicate an infectious disease? And when there's an animal reservoir, I teach that we can eradicate something from human populations if there's an animal reservoir. So with the concept of reverse zoonoses in mink, house cats, does this mean we are not going to be able to eradicate this? Is that impossible?
Well, if it really is a reservoir, and if it's just mink, but we have a lot of other species that are related, like ferrets and things like that.
So there is a note in the chat from Taylor Weary in Tony Goldberg's lab, looking at all sorts of bat species in the United States that may be able to become reservoirs of this virus. That's scary. Although I think Taylor didn't quite say that. She just said they're looking at these different bats.
Maybe a little bit more for the origin of different ones. We're hoping it doesn't happen, she says. Yeah. Yeah, I hope so too, Taylor.
So Ajay, if I can add a non-infectious disease component that I would always like to add, which is that, you know, when I showed the slide about how air pollution exacerbates the risk of dying from COVID, and some of the modeling studies that shows when you shut down fossil fuels, you save lives. Just a reminder that air pollution kills between 1 in 5 to 1 in 10. Every fifth or 10th death comes from air pollution. And so as this pandemic has shut down the global economy, and you've seen these pictures from Delhi, India, of, you know, before and after, you know, clear skies that they've never seen before. You know, as we try to build back better, this is a golden opportunity to also build back better, not only in disease prevention and surveillance and everything we need to do for the infectious diseases, but to realize, you know, the lesson here that when you shut down fossil fuels, you see immediate benefits, that this can be part of the recovery and part of the coming out of COVID, that we look at the next giant problem, you know, as far as climate change, pollution, and, you know, that's something else to make sure that we don't disconnect these risks.
Yeah, well said. Very well said. The most recent comment comes again from Donald Kretschmer, talking about sort of messaging. I'll just read it. Seems like part of our problem in the country is one of sociology, psychology, and messaging. The best solutions in the world are only effective if people believe in them and are willing to change their own behavior in response. How do we get to a place where people are acting in not only their best interest, but also the common good? And I'll react to this because this is a topic that's near and dear to my heart. Because, you know, for 5 years now, I've been teaching a class called Conspiracies in Public Health, where we try to tackle some of these issues, but I don't touch how to change social norms, because that's very hard, and they kind of happen with sometimes without any intervention. But I teach about sort of how to have one conversation at a time, starting with listening and building trust with people who have views that are different from your own. Not an easy thing to tackle, and I can also add to that by saying, you know, Donald asks, you know, how do we get to a place where people are acting in not only their best interest? I think some people don't even act in their own best interest. So it's more challenging than I think we sometimes realize, and that's hard. Another seminar, Jonathan, for you to schedule as part of the series or other series. I think we go until 5:30. Is that right?
Yeah, I can fill in 30 seconds off of your last one.
It's all yours. Yeah.
Yeah, changing human behavior is about the hardest thing, but we know from public health, we have strategies, and we learned a lot from the anti-smoking campaign that you need, you know, trusted messengers that people identify with. You know, doctors in white coats saying, holding up black lung images didn't work when you're dealing with teenagers, but putting up young models with cigarettes up their nose and black teeth, you know, getting to the right message is important. So, and, you know, simple messages repeated often by trusted messengers, finding the right messengers, and making sure, and in this day and age with social media, we really have to be vigilant, and we need to, you know, be out there and communicating science effectively. And scientists should not be shy, and scientists should learn how to not use jargon and to communicate more effectively. But as you said, Ajay, the first step is active listening, respect of your audience, and knowing where people are coming from. And you can't communicate well unless you're a great listener to begin with. So But again, this is, and I'm in this area, climate change, it's very polarized and political, especially in our country. And over again, we're reminded, simple messages repeated often by trusted messengers. And I think that's one way that can help.
Well, Kristen, do you want to have the last word? Should we let Jonathan have it? What do you think?
I was just checking to see what the last chat was. No, I just want to thank you guys for inviting me today. It's been really fun.
No, thank you. It was great to hear all the questions, different perspectives. I learned a lot myself, so thank you. And I hope everybody enjoyed this session. And remember, the next Global Health Chat Tuesday is March 30th. So stay tuned with emails.
And thanks for the audience's questions. That made it really good.
Yeah. Thank you, everyone.
Ajay, thanks for leading us, and Kristen, thank you, and the audience for showing
Thanks,
up.
guys.
Thanks for the organizers too.
All right. Have a good night, everybody. Have a good evening.
Bye, everyone. Thank you.
Good night.
Thank you so much.